Welcome to the Health Tech Headlines podcast. I'm your host, Christine Drury, and today I'm joined by Dr. Shrikant Devaraj, Vice President of Health Analytics at Syra Health and leader of Behavioral and Mental Health Business Unit. Welcome to you.
Thank you, Christine. Thanks for having me.
We're having an important discussion today about the mental health crisis in America, and the statistics are staggering. What do you know about what's happening today?
Yeah, in United States, based on the latest data from CDC, about 22% of adults have been informed that they have some form of depression by medical professionals. But 1 in 4 adults have got a major depressive episode in the past year. 1 in 5 adolescents have got the same sort of experiences in the past year as well. The suicide rates or attempts have been going up, especially among youth. When it comes to the substance use addiction, about 60% of individuals 12 years and over have engaged in some sort of substance use. Either it could be alcohol, tobacco, marijuana, opioids, and other drugs as well. So overall, if you see the statistics, it's alarming. But again, all these are self-reported, and it is not being shown by. It's actually most of the cases there are many unreported statistics that goes behind the scenes, which people may have issues, but they may not know. So these, I would classify these as just an underreported statistics. So those are alarming. But when it comes to the gaps in healthcare or in behavioral mental health space, stigma has always been an issue, especially on those, be it any mental health and behavioral health in general. So mental health is something personal for individuals. So there are cases where they may not share those issues with their family or friends who are seeking help because of the stigma associated with that. So those issues combined with whether or not you know you have an issue or not, that is another aspect that is missing. Because I may have anger issues, I may not know am I doing an annual screening on mental health? Not at all. Just like physical health, where you are able to know those measures where you currently stand and could take preventative action, that is not there in the case of mental health. And when it comes to the outcome differences, so my behavioral health outcomes would be different from yours. So there are differences across gender, race, ethnicity, rurality of the place where you live, and also across other demographic groups as well. So we cannot have like a one solution that would fit all those kind of approaches too. And behavioral mental health, as you may know, it also has a direct correlation with other aspects of addiction and other co-occurrence of conditions, chronic conditions. Combined with that, there is coping strategies for those chronic conditions where there are issues going on with that too. So overall, in a huge landscape of behavioral mental health things, there are gaps that persist. And I know at least some policies and private organizations are trying to, or even from government, private organizations, all of them are trying to put things together to see what would be the best solution moving forward to close that gap.
It's so helpful to hear the information you shared. You mentioned some of the causes of increasing mental illness. What do you think are some of the other factors that are driving this to be just a really common condition?
So there are a few conditions, like right now they talk about anger, anxiety, insomnia, depression obviously, and then we have substance use. So we classify, it's easy to look at behavioral mental health in these 5 crucial domains, but there are other wraparound factors that could be a precursor for symptoms. When we say precursor for symptoms, even when you talk about suicidal tendencies, there are multiple facets of suicide that needs to be taken into account. Like one is thinking about, I wish I don't get up in the morning, that kind of a suicidal tendencies versus forcefully cutting yourself or trying to kill yourself. So those are even though it comes under suicidal attempts or the hope of attempting a suicide, these are precursors for that. Like if there are differences between these two, and the treatment and the crisis plans are different across these, and there are subtle differences across, say, PTSDs and OCD disorders and others, mental health disorders. That is totally different. That springs out of these core domains. When we say anxiety, there are numerous anxieties that needs to be addressed. So at least even before we get to that, we need to know whether these individuals have those issues. That way you have a path forward to know where the crucial issue lies, and that way you can seek help for that issue that you're looking into. So those are some of the aspects that especially in this particular space, people have to be educated on. First of all, what issues they have, assess themselves, and then make sure where they currently stand on these kind of symptoms of severity across these domains, and then take actions.
It's really, really good information, super helpful. I love that you mentioned solutions, because I hear a lot of talk about the problem, but Syra Health actually has a solution. So tell me a little bit about it.
Absolutely. So we have a flagship product called Serenity. This particular platform, I would say it's an end-to-end behavioral mental health solution, which focuses predominantly on prevention. So there are multiple features in that platform where individuals will be able to take routine assessments to know where they currently are on these 5 domains, as I mentioned earlier, on anger, anxiety, depression, insomnia, and substance use. Once people know where they currently stand, and that is routinely sent to them in terms of a more user conversational way, in terms of asking these questions, and once they fill in on a routine basis, that would allow them to see the trends of their conditions, of the symptoms over time. That could allow them to even further go to the next level in terms of what type of treatment plans they need to get into. So one part of our solution is on the assessments, routine assessments. The second part is on the treatment itself through technology. So in technology, we have 4 psychologists in our team who have created psychoeducation content. So we convert these interventions, we call them as interventions, into both passive and active interventions. The passive intervention is all about psychoeducation. We are educating the users in terms of what they should be doing if I have, say, no sleep at all or insomnia issues, sleep control, hygiene, sleep hygiene, activities that they have to do and educate themselves all about. So those are some of the routine activities and educational activities, practice, and other information that the users need to know to change their behavior so that they can reduce the symptoms. So that is one part of the treatment or interventions, I would say. The other part is active interventions. When I say active, how do I change your behavior? So we are giving the tools to the user so that you can use that information, put it into a practice. If I were to open up a new hobby that would relieve my mental health or reduce my symptoms of mental health, maybe reading a book, if that is an activity that I would like you to do, this particular tool or an app will allow you to set those schedules and then write some qualitative information about that particular activity. Essentially, we are all about data and analytics behind the scenes. So all of these information that goes into the pool, it sets up reminders for those individuals to do that particular activity. It's like a behavioral nudge. We are going behind you and then telling you, hey, you promised you will do this in this particular week. Here is a time for you to do. And then reflection. It's all about reflection after that. Hey, have you done it? Have you not done it? If you have done it, okay, did that help you improve your mental health well-being at that moment? And also from the other aspects of the things, that obstacles or barriers that are facing him. Okay, I could not do it. Okay, tell us reasons why you could not do it. That allows us to, behind the scenes, collect those qualitative information that is very rich for any therapist to know what kind of treatment these individuals need to be provided. So those comes under the treatment group. So we talked about assessments, we talked about the treatment. The third is obviously on the engagement side. We have an AI chatbot, a diary that they can actually enter their thoughts and feelings, emotions on any time, any day, and that could help individuals get to know what they need to do within the app. That engagement part is also available. And then we also have reporting. So these data that we talked about, those are qualified and brought into a report format so that they can either use them for their purposes or they provide that particular information to their own therapist if necessary too. So that talks all about the prevention landscape. How are you changing your behavior, behavioral nudge, reportings, and other capabilities? There is a point where technology can help you with saving your, either making your mental health symptoms lesser. That's only to an extent.
Mm-hmm.
But also you need a human intervention to completely make you cure from those particular actions. So it takes time. Every individual has their own way of doing this. So that is where our telehealth platform kicks in. So we have a network of providers who will be able to provide therapy, and these are licensed therapists as well. So this is where our therapist would be able to collaborate with the individuals, because they also will have access to the reports and also the data and historical information about the user, and they will be able to make actionable recommendations before that first appointment that they will have with the patient, because they will already know what issues this individual had over time and what potential treatment that can be given right from the first the initial visit itself. So they will have an absolute information that they can have for making that decision. So that's that empowerment that we would like to give to those therapists using our data and analytics platform behind the scenes that runs, and obviously with patient consent, all of these information can be transferred to the therapist.
And it sounds like it's going to result in some saving of some money on the user's part, because the therapist already has all the background information you would typically get from an initial couple of appointments that might be required. Is that true?
That is absolutely right. So one of the ways you would also look for is these behavioral mental health sessions with therapists. They could go more than one sessions for, on an average, 8 to 10 sessions spread across a year, maybe,
Mm-hmm.
depending upon how they are able to treat those particular patients as well. But during this time, you could also see the savings where you are also trying to make people better in their behavioral mental health status. That would mean that in a few sessions, you're effectively seeing the treatment, and then you're leaving the user to practice things on their own. So that is one way to look at it. The other way to also look at it is that you're also trying to reduce or alleviate the symptoms as well. Imagine that would also probably would have added more healthcare cost to the organization's payers and providers as well. Just before it becomes serious, you're trying to control them right at the grassroots level. So those are some of the aspects. From a cost aspects, we strongly believe these tools could be helpful.
It's a lot, and it sounds very sophisticated. Serenity does. How unique is it versus another solution that might be available?
So since we focus predominantly on prevention to start with, human intervention, yes, it is there if necessary. So one of our key offerings in this through products is going to be the use of data and analytics behind the scenes, where we are able to leverage that for quality decision making for the individual and also for the therapist too. So we want to give users that choice. That is where we come in. That choice would be, can technology help me? I know there is stigma associated with that. We can break the barriers on those stigma, but at the same time, they need to take that step. If the users want to go to that level, yes, I mean, we have this particular platform that they can use to reduce the symptoms of their mental health. Now, there may be cases where you may probably be mild on many of these severities, and you may think that is not necessary, or maybe no symptoms at all. but still all our content and other things is actually making you change your behaviors in a positive way. So it's not just for those who have mental health issues. This is also across the country, across every individual would be able to use this particular app and be informed about mental health and behavioral health. There are several things that we are trying to push the content, that we look into the emerging trends of where things are happening, and we create curated content in a nice format that is more understandable for the public, and reducing this medical jargon and putting it into a way that they can use it for their practice. We are all into this action. How do you change your behaviors in a positive way? And you don't have to have a behavioral mental health symptom to practice it. It could also be for others as well.
Wonderful. Sounds like it could work for everyone. You mentioned the data and analytics on the back end. So how does it work? Is it constantly learning, and then you're pushing that content out with additional suggestions based on what you're learning behind the scenes?
That is right. And we will be leveraging the data behind the scenes in terms of the validated questionnaires, and also looking into their profile, looking into what kind of behavioral health symptoms they're having, because maybe according to the validated questionnaire, I may not have an insomnia issue, but based on the conversations with the app that we have, we sense that behind the scenes our models are going to capture the nuances of those conversations that we'll have to see if there is a higher risk of particular behavioral mental health symptom that would allow us to create curated or personalized experience for those individuals to push through and in-app recommendations for them to kind of use to change it at that moment, so that you don't wait for the worst things to happen before things escalate.
That's the prevention that I hear, but it's confidential, right? People don't have to worry.
That is right. All the data, absolutely, all the data is secure and private. And in this particular case, all we are doing is, like even when it comes to the telehealth, we have our own EMR system. It's all HIPAA compliant. So that allows the data to sit on those particular aspects too. But from the prevention side, so we intentionally broke this down into the prevention side, where we are not using any of those use of private data for any of the marketing or other purposes as well. So we'll be using it for their own personalized benefit and aggregating them to a data pool where we can actually start pushing curated content for all the users for that particular issues.
That's good. Nobody has to worry about their data being seen. I understand Serenity is part of a research study. Tell me what you understand about the study and what it might mean for Serenity.
Absolutely. So we are scientifically driven companies. What that means is we don't want to assume that the app we have out there is going to be the single point solution for all. So what we have done is we have gone through a rigorous research process. So we have recently got an approval from an institutional review board, IRB, to do a randomized controlled study. So we have brought in third-party evaluators to conduct this particular study. So there will be close to 150 users of this tool who will be technically using this app, and there are 150 people who may not be using this app. And then we are trying to compare. We are going to send them some surveys as part of this particular process all along, and then we are going to try and test the efficacy of the app. And this efficacy could come in multiple ways. One of the key things would be engagement. We would like to see how engaged they are with this particular app, especially from those who are using the app. Number two would be, are there changes to their symptoms of behavioral mental health? If so, we are only looking at 2 months for now to see whether there is any short-term changes to these particular activities. Once you know there are going to be some changes happening that would be beneficial for the app, at least in terms of the research validation side of things. But at the same time, there is also other components included too. Like, we would like to see to what extent are people interested in the psychoeducation content? Are they able to practice some of the interventions that we talked about? You will be able to holistically see the activities of those individuals with either moderate to severe depression symptoms. So those are going to be our study group that will be following them. And after 2 months, we anticipate the research to wind up, and then we'll be putting our findings together along with those third-party investigators. And then the hope is to bring them into the scientific audience to validate our study. So that process has been underway, and we expect to see some tangible results coming up in the next quarter.
I like the transparency of it, and some scientific evidence to show that it works will certainly add to the credibility of Serenity. And I should mention it's Syrenity, Serenity. That's the spelling, just like Syra, Syra. How popular do you expect Serenity to be?
So our ideology behind the app was looking at the existing gaps and then create a solution around the gap. So it was not just creation of another app and then fitting into the space. So we chose the former approach. So that allows us to create tangible measures and outputs to the customers that we serve. And that allows also them to create a value from our app, what outputs that we are able to produce. And since all of these are customizable, our app, everything is done in-house. So that allows us to customize it to the client needs. That also helps them to use a one-stop shop for getting all those information that they need to take it to the next level. So we feel this uniqueness will allow this app to be used more within the entire landscape of our preferred clients and others, as well, the industries and other aspects who really want to solve the mental health crisis for their stakeholders.
As we talked about, it sounds like it could be beneficial for anyone. Who is Syra selling it to?
So we have a customized app that we will be able to produce it for employers to pass it to their employees. Payers and providers, now it's all about value-based care, and they also look for tangible outputs and measurements as part of this value-based care. So payers for their members, providers for their patients, that could also help them for tracking those individuals during revisits of those individuals as well. So our platform could fit in that particular space too. And then educational institutions. So we have this particular app also from a youth perspective, 13 years and over, and the data is curated. Those questions are validated. We have a child psychologist in the team who has validated all the content, the curated content for the passive interventions for the youth as well, so that it gets engaged to them, and then they will be able to practice those aspects as well. So this is from a youth perspective. So for educational institutions, we all strongly believe 13 years and over, and also the college students, this app will be beneficial. So imagine from a college experiences where freshmen, they are always nervous and anxious about how they will be sustaining this particular aspects. We will be able to cater to that particular audience through this particular aspects, where we can, instead of becoming more severe, we are preventing it right in the beginning itself, and then giving them the right tools to change their behaviors positively to influence them.
I heard you talk about the prevalence, and that group seems to be the ones hit the hardest, the students and the young people. So bring on Serenity for those groups. That's really necessary, and really glad to hear it. Tell me a little bit about the price for these users.
Yeah, I think so our app is more customizable, so the clients will be able to pick and choose different packages from our portfolio that we provide. So some clients may not need telehealth. We have a different pricing structure for them. If they use telehealth, we subsidize the prevention amount. So usually our pricing for the prevention features is on per person per month kind of a setup, or per person per year kind of a setup too. And we were able to work with the clients to give them the best possible pricing packages that could allow them to curate and customize. Some clients requested they have their own set of qualitative questionnaires, they would like to push it through our systems too, so which is possible. So that pricing models will change based on the nature and the amount of users in this particular aspect. So we do have a tiered systems in place as well that allows the users to pick the best approach with what scope they would like to have.
Okay, nice tailored menu. It sounds like you can pick your meal based on what it is that your customers need.
And we do have, this is currently catered for business to business.
I love it. I love it. So compassionate. It sounds like innovation meets compassion at Syra Health, and really glad to hear about the access to everyone. So important, again, going back to those prevalence numbers, to have a solution that's dedicated to reaching everyone who needs it. Again, thanks to Dr. Shrikant Devaraj, Vice President of Health Analytics and the leader of the Behavioral and Mental Health Business Unit at Syra Health, for joining today.
Thank you, Christine, for having me.
Take care.